A medical social worker will Federal Medical Center, Avery, Bauchi State, Northeast Nigeria. I've been a practicing medical social worker for about 3 decades. Thank you very much.
Thank you very much. We'll also call on Samson O. Abiola. Samson, are you there? Samson. Samson, I don't think you are here. If you are here, just type yes, I'm here. Let me see you. Samson, are you there? Oh, Samson. Okay. Samson Eze. I'm not talking about Samson Eze. I'm talking about Samson Abiola, our facilitator. Samson, if you are here, please just type yes. Let's be sure you are here. Samson Abiola. Okay, let's move ahead. Okay, George. Okay, rather than calling the presenters one by one to do their introduction and wasting time, I think we'll just move over to Alhaji Abubakar Bichi to tell us one or two things about medical social work, importance of medical social work, and how you can become a medical social worker. If what qualifies you to become a medical social worker. Over to you, sir.
Okay. Good evening once again. As the term implies, medical social work, you cannot be a medical social worker or you cannot know medical social work without knowing social work. Then what is social work? Social work is an academic discipline as well as profession. What is meant by academic discipline? It's an academic discipline that you can go and acquire in the university or in tertiary institutions like polytechnics and monotechnics. There are quite a number of tertiary institutions ranging from monotechnics, polytechnics, and universities that offer social work programs in different names. Some they call it social development, some they call it social administration, some they call it social welfare, some they call it social work, especially in university. You go and have Bachelor of Social Work, Master's in Social Work, as well as PhD in Social Work. In Polytechnic and Monotechnic, you go and have what is called Social Development, National Diploma, and Higher National Diploma, as well as Social Welfare or Social Administration. So that's academic discipline. You can as well, having acquired the knowledge, and you can go and teach the same subject in university or in polytechnic. In essence, I'm trying to say you can have a knowledge of social work and be a teacher. You will be known as educator, person who teaches social work. Why do you call it a profession? It is a profession because it equips people interested in the knowledge. After acquiring the knowledge, you can go and have practice. You practice it. Where do you practice social work? You practice social work in prisons, in police formation, military formation, in court formation, in social welfare offices at the local government level, at the state level, as well as the federal level. And you can also practice social work in court. You can practice social work in hospitals. Ideally, there is no human organization, especially informal setting, where social work doesn't have a place. In essence, what I mean, in every human gathering, especially a human setting, official setting or formal setting, if there is no social worker in that gathering, then something is wrong in that setting. Why? Because fundamentally, a social worker is somebody who advocates upon citizen rights to ensure protection and promotion of citizen rights. How do you come about social work? Social work is developed in a combination of many disciplines. You can have aspect of sociology, aspect of psychology, aspect of law, aspect of medicine, etc., etc. It's what constitutes social welfare, social work. And social work is purposely being studied and being practiced in order to enhance the citizens' life or people that are in need. In fact, even people that are not so-called less privileged, social work has a place for them. Then how do you become a medical social worker? A medical social worker, after obtaining undergraduate qualification, then you need to go and have a master's program to specialize in medical social work. Why? Because it's highly specialized and it's only being practiced in medical settings. And what it is, the medical social, what is the medical social? Medical social is a specialized branch of social work that focuses on helping patients and their families navigate health care system. It's a kind of a holistic approach that takes into account physical, mental, social aspect of health. You have a patient being admitted in a hospital, but mainly it's having medical conditions or physical conditions. But the most important aspect of his illness is more to do with social or mental. So that is why it's highly specialized. One has to acquire knowledge before to practice medical social work. And what is the goal of medical social work? The goal of medical social work is improving the overall well-being of who? Of patient and his family. Why? Because sometimes if an individual is sick, that can extend to his other or to his significant others, those that are around him. Take, for example, a father with a wife and children, and he happens to be sick and being admitted in hospital. That his illness may not only affect him, it affects as well as his wife and his children. So the social worker is there to ensure that the improvement of that and the well-being of that patient is paramount. Are we together?
Yeah, go ahead. We can hear you.
Are we together? Hello?
Hello, can hear you.
So again, the aspect of medical social work, we have various of different kind of intervention that we have. For example, we have emotional support. What is for emotional support? Let's take, for example, a case of somebody who has a retroviral disease or diagnosed with retroviral disease and is newly diagnosed. You know, definitely he will become worried. His family will become worried. Because the family, in fact, you need to tell him, you need to counsel him appropriately. This is not a death sentence. Hundreds of people, millions of people survive this disease in as far as one will take medication. So that's emotional support. Then you need to get his consent before revealing to his significant other. Certainly, you may have one problem or the other that will affect the emotional well-being of that patient or his significant other, that is his family member. You need to also offer a counseling in that aspect. Take for educational support. You can have a student who is a dropout. because of one problem or the other. Let's say he has a mental illness. Then you need to support him to ensure that he is back after he's getting better, he's back to his education and to continue without any fees. For example, when you talk about the social connection, you can have indigent patients of different varieties. So you need to get them, you need to get resources, you need to connect them. For example, if you have an indigent patient, but who happens to have a skill that he can do one thing or the other for a livelihood, after my being referred to the hospital, you need to connect him to where he can get of what to do because of that skill he has or that educational qualification. That's the resource connection. When you talk about case management, you often have a case of a patient that will continue to be managing his case over time. Let's say when you have a cancer patient who needs to have counseling, you have to have a kind of palliative care, you need to continue. Talk about community outreach. You need to reach out to community on behalf of patients, advocacy. In terms of patients that cannot put up their bid, you need to sit up, you need to reach out to community, you need to go to the gatekeepers, inform them, go to the philanthropists, go to the rich people, go to the religious bodies on behalf of patients to advocate on them to get support to come and pay for their treatment. So there are many aspects of activities that you can do if you are practicing in hospital. You have, like I mentioned, you may have different varieties of cases. In fact, in the course of that, you can have also a family problem within the cycle of the patient. So if you try your best and that you cannot handle the aspect of the family issue, which is a social issue, then you need to connect, you need to refer to conventional social welfare officers we have at different level of in our society. So the last leg of the question, where can somebody have the knowledge to acquire the knowledge? Hello?
Hello, yeah, we can hear you.
Hello?
I can hear you, go ahead.
The last leg of the question. What is the last aspect of the discussion? What you said, where somebody can get the...
Okay, how can people join, or how can people come on board to become social workers?
Okay. To become medical social worker, right?
Yeah.
It's very easy. When you have a basic certificate of social work, or you have a diploma of social work, or you have a HND of social work, or you have a BSc of social work, or Master of social work, you can easily get acquainted, you can easily get registered with an association which is called Association of Medical Social Workers of Nigeria. Especially if you have, or if you are already practicing in health settings, and again, apart from being specialized to the Association of Medical Social Workers, that's a general registration which you can as well register. What is it? You can register with the Nigeria Association of Social Workers. That is for everybody, both the educators, the one practicing in the hospital, the one practicing in the conventional ministry, they are all members. But if you want to practice in any health setting, then you need to register with the Association of Medical Social Workers of Nigeria. And in fact, that one, the certificate of practice being issued by that association is boldly written that this guarantees somebody to be employed in hospital setting. So any other question with Dr. Osaji?
Thank you. Thank you so much for now. We've learned a lot from...
any aspect that
Yeah, we've learned a lot from your few minutes of speech, and I'm sure everybody here must have really benefited. We'll just take 3 questions, then we'll move on to the next speaker. Okay, please, if you have any questions, just raise your hand up. Just 3 persons, please.
I have seen one question being sent to start.
You say what?
Can I respond to it?
Okay, go ahead. Go ahead.
I have seen a question in the chat box. I saw somebody ask if a caregiver a medical social worker. Yes, a caregiver is a medical social worker. But one thing people should know, everybody that is assisting or that is helping any other person is also a caregiver. In fact, you can even call a doctor a caregiver. You can call a nurse a caregiver. You can call a community health extension worker a caregiver. But then a caregiver, just a caregiver does not qualify if you don't have the prerequisite training, which will make you to earn a qualification and to get the job being done. You cannot be a medical social worker. You have to have the prerequisite training before you can be considered a social worker, and at least a 1 year certificate in social work that can guarantee you. That's what qualifies you. But just an ordinary caregiver cannot be qualified, because a caregiver is a generic name. Many people can be termed as caregivers. So I'm sure the other person must have known. You must have gotten the answer.
Thank you for that response, sir. Let's take this question from Moses Blessing. Moses Blessing, over to you.
Thank you, sir. Yeah, thank you very much, sir. My question is, what organization can offer this diploma certificates? Like, if you want to go to the training, what are those institutions that can offer this training to become a social worker, medical social worker?
Where are you residing? Where are you based in Nigeria? Where are you based?
Where are you based? Moses Blessing, where are you based in Nigeria? Unmute yourself, please.
At Abuja, FCT Abuja.
Abuja,
FCT
okay,
Abuja, yes.
Abuja. Well, in FCT for now, within the FCT, we don't have any institution that is offering any social work. But just across Abuja, if you just go to Kaduna, Kaduna Polytechnic, they are offering national diploma, they are offering higher national diploma. And if you go back to the other, if you get to
yeah.
Have you gotten me right?
Blessing, are you there?
Yes, thank you very much, yes, sir.
Okay, thank you.
Yes.
Let's take a question from Oludaye DOT. Oludaye, are you there?
Good evening. Yeah, Dr. Zazi, thank you for the privilege.
Thank you.
All right. I actually wanted to know what exactly is what qualifies you to register with the Nigeria Association of Medical Social Workers, and what is the relevance of the certificates awarded by your own platform, as we have participated in the lectures and all of that, and now we are here. So I just want to know how how your own certificate is relevant to practicing as medical social worker, and also what is the qualification, if the guest speaker can actually answer that, the qualification to be a registered member of Nigeria Association of Medical Social Worker. Thank you.
Okay, first, if you have any qualification of social work, that's one. Secondly, if you are practicing, we have practicing medical social workers without prerequisite qualification. social work, national diploma, higher national diploma, bachelor of social work, you can get the register with the Association of Medical Social Workers. More so, if you are practicing in hospital setting or in health setting, health-related institutions. You know, we have NGOs that are health-related. They are purely health-related. So that qualifies you to become a member. Are you clear?
Yes, that's clear. For example, I'm saying everybody here are not people from social works background. Of course, probably having discipline that is actually related. For example, I am an applied psychologist and I also am a therapist for special need people. All right. So now,
where do you practice?
So how do I come in now? Like, what's the relevance?
Where are you practicing right now?
Where do you practice
in Lagos?
Right now, you are on. Where in Lagos? Where? Which is organization? You are in Lagos. Where? You are practicing private.
Okay. I actually work with a private home for special needs children.
Private home. That's so what I will advise is for you to qualify to become a social worker, right? For you to be qualified as a social worker, I would advise you to go to UNILAG or UI to have a postgraduate diploma. That postgraduate diploma will bridge that your gap that you are having applied psychology as bachelor degree, right? So when you have the postgraduate diploma in social work, that will give you an edge that you acquire knowledge and you go to Chiltola, near Lagos, that's around Lagos. You can go to University of Ibadan. They are all offering such kind of courses. Are you clear? Hello?
Yeah, okay. Oludaye.
All right, yes. Thank you, Dr. Zaze. That's actually clear. I get you very clearly. Thank you very much.
Yes, and
Okay. Well done.
Thank you. Okay, maybe we'll just take the last person, then we'll move on to the next speaker.
I think, Dr. Zaze, you still have a question, sir.
Oh, okay. Go ahead.
Yes. I have asked before. I'm talking about the LaPlanche certificate.
Okay.
Yes. So now, I'm asking the relevance.
Okay, now, the LaPlanche certificate is accepted worldwide based on our level of accreditation. We are accredited by some international organizations. And whether it will be accepted by Medical Social Workers Association of Nigeria or not is subject to you discussing with them. But come to look at it, we have a former president of the association talking to you right now, which means that we have a relationship, even if it's on a personal level. I'm sure if he feels this certificate is not worth it, he will not be on Zoom here talking to you. So it gets to show you that you are making progress with this certificate. Then secondly, this certificate is an introduction to medical social work. Remember, there are a lot of people that don't even know about social work. And courtesy of this course you are taking right now, you've gotten information about social work, you know about social work, and you are speaking with an authority in social work. And not only that, you're going to get a certificate in social work. And like I said, most people with our certificate are working mostly outside this country and some within this country. So professionally, if you are going to a higher level of social work, he has already told you, you need a PGD, you need a diploma, and we are already working towards even having an auxiliary diploma in social work coming up very soon, any moment from now. But this certificate gives you an opportunity to have a peep into the world of social work and start appreciating it and start making a move to move into the association or the profession as it is. By the way, once the regulatory body comes on board, you must be licensed to be able to practice, regardless of whatever certificate you have, whether you have a certificate, a diploma, or whatever, you have to be licensed. I don't know if I've made myself clear.
Dr. Zaze, that's very clear now. Thank you very much.
Very good.
Thank you. Absolutely. Thank you.
Oh, I called someone and I've lost him. Okay, let me call one more person, then we'll move ahead. Kisola, what is the issue? You are bribing me to call you from there. Okay, now you can talk. Yes, unmute yourself and talk.
Good evening, sir.
Good evening.
I'm very happy with this program.
Thank you.
And I'm very happy you brought a big fish in the ocean. The question I want to ask is directly to the former chairman or the head of the social worker.
Yeah.
Unfortunately, primary health care was not organized with social workers, which they have missed a lot of opportunity. Because I got to know during the lecture, I got a lot of importance of the social worker. That is, they serve as a bridge within the patient, the health workers, in order to make the treatment being given by the health workers to be very well, to go pari passu. But local government, which a lot of people neglected, there is no arrangement for that. I want the body of the social worker to do something about that. Because, say for instance, local government was not encompassing with the pharmacists, with medical laboratory scientists. I'm talking from Ogun State, and I'm a medical lab scientist. Not that they employ me as a medical lab scientist. I was employed as a medical laboratory assistant, and from there I began to go to school to the extent I become a medical lab scientist. I want to tell you categorically, Ogun State have never employed directly a medical lab scientist, and there is a clear vacuum for the social worker in the local government. They are nowhere to be found, and their importance is very, very germane. According to this lecture that opened my eyes a lot. So, what can the national body do to make sure that social workers are in the local government and not in the tertiary hospitals alone? That will even give a lot of employment for the members that study social work as a studies. So let me wait for the reply before I fire again.
Okay, you fire again if you have another opportunity, because we need to move ahead. Yes, over to you, Alhaji Bichi. Are you there, sir? Okay. Okay, you can speak on now, sir.
Okay. You see, local government is very, very sympathetic and very pathetic situation that we have. We find our local first tier of government. You know, in what we have primary health care, we have secondary health care, we have tertiary health care. But unfortunately, the primary health care is relegated to nothing. Secretary of our state executive. What I mean by state executive, our state governor. They made local government just to be like their own personal pocket. They don't allow ideally, there should be a social worker in any primary healthcare setting. In fact, not even government hospitals. In private hospitals, there should be a social worker. In fact, when some years back, I wrote a proposal to the Federal Ministry of Health to incorporate social workers or medical social workers in state-owned hospitals and local government health centers, as well as private hospitals, to make it a law that when it has been taken, it will go down, but it wasn't, did not fell through. But we hope and we pray with the new nomenclature, Federal Ministry of will take up where it involves all the commissioner of the 36 states with the minister of health. So if that decision is taken,
Okay, thank you. I think we're having issues with the network from your end, sir. But so far, you've done justice to the question that was asked. We have to move ahead. And Akisola, I want to believe you've gotten some information as to your question. We have to move ahead so that we can call the next speaker. Mr. George, okay, thank you so much, Alhaji Abubakar Bichi. We are always happy having you on board, and it shows that so much confidence you have on Laplace Metaverse in what we are doing to ensure that people have full-scale awareness about medical social work as a profession, which so many persons can go into. I'm calling on Mr. George, okay? Mr. George, okay, are you there? If you are there, unmute yourself, please. Mr. George, okay, we can't hear you. Mr. George, are you there? Okay, so maybe we can move ahead. Mr. George, unmute yourself, please.
All right, yeah, I'm here.
Okay.
Good evening.
You're welcome, you're welcome. Please just briefly introduce yourself, then we'll tell you what we want you to tell us.
All right. Good evening, Dr. Sazid. My name is George K., an Assistant Chief Medical Social Worker with Federal Medical Center, Makudi here in Benue State, Nigeria. I hold a Bachelor of Science degree in social work and a Master of Science degree in social work with sub-specialization in psychiatry and social work, and medical social work rather. Thank you very much. I think that's what I can say now.
Yeah, thank you very much, Mr. George. Mr. George is a very lively and friendly social worker. You enjoy his company. Mr. George, we may just give you 20 minutes because of time so that other speakers can speak. But briefly,
okay,
can you tell us what a typical medical social worker's life is on the job, on a daily basis?
Yes. Yes, my former chairman or national president has already given us the generic functions of social worker. I'd like to just go very quick to the things that will carry the functions we play on daily basis. And these functions are fall under the following category. One, pre-admission issues. We handle pre-admission issues. There are people that come to the hospitals and they are unable to pay for even hospital cards. It becomes the responsibility of the social workers to ensure that they procure medications and procure admission. You know, because the Bill of Rights has made it mandatory for all hospitals to admit and so the social worker must always be around to ensure that this right is enforced. So when you have patients or families who come to the hospitals and are unable to procure medication or unable to get admission, it is the responsibility of social workers to handle such pre-admission issues. We also handle what is called discharge problem. It is also possible that usually 70% of our patients will end up not having money to pay for their medical bills. It becomes the responsibility of the medical social worker to work with the management team and ensure that either these bills are waived or he works with NGOs and other organizations to ensure that these bills are paid. We also do what is called ward rounds. You either follow a consultant for consultants ward round, or you do the medical social work ward round. during which you are expected to do assessments of the patients, psychosocial assessment of the patients, the assessment in terms of their ability to cope with medication or certain lines of medication. You also look at their psychosocial factors that may influence the treatment or recovery. For example, there are psychosocial factors that influence recovery, such as patient literacy level, patient's income, family background, educational background. For example, a patient who is unable, a patient whose literacy level is high will have the ability to read, follow prescription. But if you discover a patient does not have the ability to follow prescription because of his literacy level, it becomes the responsibility of social workers to interpret the medical jargons and also help the patient comprehend and follow medication. We also handle issues. We also handle what is called post-discharge services. For example, if a patient is discharged, that's not the end of it, because the fundamental goal of social work, whether medical social work or the generic social work, is to restore capacity of patient, help this patient after treatment rehabilitate them into activities that will help them to also perform and function better. So after discharge, it is the responsibility of social workers to do what is called what we call post-discharge services. That means you have to do home visit. You visit the patient, you make sure the patient is taking medication as prescribed by the doctors at home. You are also have the responsibility of repatriation. When you have patients who become medical destitute in the hospital, maybe after treatment, they don't have relations, they don't have anybody, no address where to go, it becomes the responsibility of medical social workers to repatriate them to their destination. It is also part of our daily activities to ensure that patients ensure that patients disclose their status, what is called status disclosure, meaning that for certain disease conditions, some patients will not want their status to be disclosed. Your status is going to affect the general society. So it becomes the responsibility of social workers to help patients to appreciate that when they disclose their status, it helps the society. For example, if a woman comes down with HIV and she does not want her husband to know, she does not want her business partners to know, it's going to be a problem if we don't help her to disclose her status to her husband. Because if you disclose your status to your husband, that will help in the man will actually have to agree with the fact that the wife is down with HIV. And so he also help her to take medication. Instead of hiding your status and then not being able to take your medication when you are supposed to take it, because you have to be hiding to take it. And when you disclose it, there's going to be what we call social support system. You have support groups that will be supporting you. And so it becomes the responsibility of social workers to help patients adjust even after treatment. And also, part of our daily responsibility is also to resolve patient healthcare providers crisis. And some of these crises could arise because the patient is not understanding the treatment line. So they may be having issues with doctors and nurses and pharmacy. And sometimes they even have issue with the environment. So it becomes the responsibility of medical social workers who also help them appreciate the issues in the health sector and also help the healthcare provider to understand that these are patients and they come down with issues, and so you should always treat them as patients, and because some patients can give issues to healthcare providers. So we come in to resolve those issues. It is also our daily responsibility to make sure that we advise management of hospitals on issues of social welfare. Those issues are usually handled by heads of department, people in the categories of directors. It is a responsibility to implement, to formulate, and help management to implement policies that are patient-friendly. These are some of the things we do on daily basis. And that is also in addition to also holding case conferences, case management. Case management in this case mean that we also handle case management. In case management, it means if it's a matter that concerns a clinical psychology, you refer to them. If it's a matter that concerns a hospital chaplain, you refer to him. If it's a matter that concerns a pharmacy, you refer to him. Because there's what we call social work of everything. A social worker is supposed to be like is actually a case manager. People believe that he knows everything. And so it becomes your responsibility to update yourself and make sure you have the requisite knowledge so that when patients present their cases, you should not dismiss it, but you should be able to direct them to where they can get help. It is also our responsibility to also connect patients to resources outside the hospital. Sometimes it means working with other NGOs, with other organizations, and helping them to get resources that will help them in adjusting. Because once again, like I said, the goal is to help patients restore their capacity for better social functioning. Help patients who are destitute, who are unable, who are distressed, to be able to procure medications in the hospital. And then work with the management to be able to ensure that there are policies that are patient-friendly. And then we also have the responsibility of training young social workers in the hospital, which means like the people who are on this program, when you send them for internship in our hospital, it is our responsibility to take them through the daily activities of social work, help them adjust, help them understand the practice, the ethics, the principles of social work practice. I thank you. Do I go on?
Okay, thank you.
Can I go on?
Mr. George, okay, thank you very much for your time. You've really done justice to what we hope to know about the typical life of a social worker at a place of work. We'll be taking 3 questions here from anybody that has any question to ask. Alhaji Bichi, your hand is raised up. I don't know, do you have anything to say, sir?
Yes.
Okay.
My very good colleague has done justice to his presentation, but the only area I wanted to draw his attention for the benefit of just listening, when we talk about disclosure of status or disclosure of status, like, am I communicating?
Yes, go ahead.
Yes, I'm hearing you.
Yeah. What I'm trying to say is very important and is very vital, because you are talking to a large gathering to emphasize the area of consent. Even between a husband and a wife, there must be consent before you disclose the status of a husband to his wife or the wife to her husband. And vis-a-vis even the children, you need to have that consent. It's very key. Let people take it that when a woman is tested HIV positive, when the husband comes, the social worker will just go and reveal it to her, no, or to the husband. There must be consent. It's very important. And just the area I wanted you to emphasize on, consent.
Okay, thank you very much, my president. Actually, what we have is that we have what is called, we have a consent to disclose. And so that is a process. You social workers have to actually work with patients to appreciate the fact that if you hide your status, it is going to affect your partner, the society, and every other person. And so they take you through a process. And when you agree to the process, you sign what is called consent form. So consent to disclose, just the way you do it in the bank, or just the way you sign before you get an operation in the hospital. It actually is a process. The time wouldn't allow me to start going through the process. But like he said, it's very important before a patient discloses or her status, is supposed to fill a consent form. And the consent is not just consent, but informed consent. You are supposed to get an informed consent and then you sign. Informed consent means the patient is well informed about the importance of disclosing the status. So the patient will now give informed consent. So informed consent means that the patient really understood the importance of disclosing his or her status, because we have issue when patients don't disclose their status. No, don't forget that in as much as confidentiality is one of our basic principles, we also understand that people have also their rights. Where the rights of a particular patient stops, that's where the rights of of the families begin. And so before patients disclose their consent, they go through a process and then they make sure that they come to a point where they understood, and then they sign what is called informed consent form.
Thank
and
you
of course,
very
even
much.
for
Okay, are you through?
yeah, thank you. Yeah, I think yes.
Okay, thank you very, very much, Mr. George. Okay, from we can all see that we are talking to professional giants in the field of medical social work, and we can see the way it's flowing as if we're actually on the field working in location. Thank you, Mr. George. We'll just take 3 questions from people on ground, just very brief, so that we can move ahead with other facilitators. Raphael Obina Amalaha. What's your question, please?
All right.
Okay, good evening, sir. Yeah, thank you so much for this wonderful lecture. My question is this. I'm meant to understand through the course that we wrote text today that a patient has the right to make decision on his health issue. Now, what if in a situation where that patient is incapacitated to reason well in the case of psychiatric issue? Now, if you allow that patient to take decision, it might affect him or her. In this situation, is it not better for the social health worker to assist that person in taking decision that will be for his own benefit? Even the family has the right, so, but they may not know the details or the skill or the professionalism involved in what the social health worker is trying to inform them. Is it not better to allow the social health worker to assist in that situation? Secondly, sir, I want to advise for the employers to always motivate the social health workers so that they can discharge their duties effectively, because with their function and roles, the level of health challenges in Nigeria or in the world will reduce drastically. If you are not paying them very well, it will lead to corruption and malpractice of their functions. In this case, there are someone I know. Okay, let me just cut it here. So they need motivation. They need, very nice salary, mainly those people that are working in the remote areas, so that they can, from the heart of them, they can be able to decide their duty effectively and achieve the targets. Thank you, sir.
Thank you, Mr. George.
All
I think
right.
you can respond to that first question.
Okay. Thank you very much. I think I'll leave the second question to my national president on motivation. But let me go back to the first question. There is actually what we call principle of client self-determination or patient self-determination. That is a right of a patient to determine a treatment pattern, a treatment choice. However, when you come for internship, we are going to teach you the limitations of the principles of client self-determination. Because, for example, a child cannot determine how he or she wants to be treated. For example, a patient that's mentally unstable cannot determine how he or she wants to be treated. Now, for a child, we want to treat a child within the concept of a patient system. Patient system means you have a patient, you have a family, you have his church, you have his organization. So there are decisions that if the child cannot take, the social worker will enter into contract with the family. So it means the family will help to take those decisions. Because it's very important that the patient or the patient's relation take the decision, because every decision you take, there are financial implications and there are other legal implications. So but when you come to a point where both the families too are not mentally stable, or they are don't have the mental capacity to take, then we also have to rely on a concept that is called, that's what we call informed consent, presumed consent. Presumed consent means as you walk into a hospital, it means you've agreed that you're coming for treatment. So it means the hospital has to treat you, irrespective of whether you want the treatment or not. But like I want to say, and I want to say very clear, that yes, we agree that patients have a right to determine how they want to be treated. And that is why we have what we call in the medical in the medical palace, in the medical, in the hospital, a concept known as discharge against medical advice. For example, if you take a patient through a process to appreciate why he or she should submit to a treatment and the patient refuses, the patient may sign a form known as discharge against medical advice. That means the patient is the one who has asked for the discharge. But then that discharge against medical advice, or what we call DAMA, does not exonerate the system or the social worker or the doctor from certain responsibility. You have to keep asking, you have to keep pressurizing, you have to keep educating the patient so that the patient is now understood why he or she has to go through a particular treatment. Now, but for patients who have the capacity to determine, it is beautiful because you determine and is in line with best practice. Why not? We'll allow you. And so we'll agree that you have a right to determine how you want to be treated, but also there are also limitations to those rights. And those limitations are covered by laws and by head bills, and also by even our practice. For example, if you have COVID-19 and you say you should not be treated, no, we'll come under the emergency law as as passed by the National Assembly, or as the president pronounced, emergency, that becomes a public health emergency. So whether you agree to treatment or not, we'll treat you because the public safety is what we're looking at that point. Though we'll keep educating you to understand why you should submit yourself for treatment. I think I've been able to answer that one.
Yes, you've done justice to that perfectly well. Over to Alhaji Bichi to talk about motivation.
You see, Mr. John is very clever. He put the difficult part of the question to me. Well, motivation. As a social worker, it's simple. The simple motivation attached to medical or to social work profession is simple. Let me go a religious aspect. If you agree, in all religions, a religion agrees to do things human, that is humanity. Social work is nothing but service to humanity. And service to humanity is what? Service to God. So first and foremost, put in your mind, apart from the salary, apart from the worldly things, put in your mind that what you are doing, you are removing pains. You are removing pains from some individual, which when you remove one pain from an individual, when you have a pain, the person, it's not he that will come and remove that pain from you, but God Almighty will also remove your pain. Am I communicating?
Yeah, you are.
Yeah, but in any case, with the person of being, that is the Nigeria Social Work Council in place, certainly the remuneration of social workers will improve.
Okay. Thank you very much.
Dr. Osagi. Very interesting when Mr. John talked about DAMA, that is discharge against medical advice. Also, it needs to be documented. It needs to be documented, and the patient or the patient relative that won't take their patient away from the hospital must sign. After all effort, fruitful time, then there must be documentation in that aspect. Do you know why? To avoid litigation. Because some patients can decide to say, no, they were asked to go, while they are not okay. But if a patient insists on living, he must sign on documentation. There must be documentation. Thank you very much.
Thank you very much, sir. You've done justice to that. Okay, let's take one more question. Yetunde Grace, please let's make our question very brief so that we can make room for other guest speakers. Yetunde Grace, are you there? Yeah, your audio is very, very, very. Your audio is not okay, so maybe
thank you for this wonderful yes, yes, sir.
Okay, we have to move ahead. Yetunde's audio is obviously not okay. Ability Echo, let's listen to you.
Hello.
Okay. Thank you. Good evening, Doctor. I'm so happy for this opportunity, sir.
Thank you.
But from the lesson we had received the past 3 days and what we've listened to today, I wish to know who employs a social worker. Because I've listened to the facilitator who mentioned that he can go extra mile to like look after the patients and ensure he takes his medication. And also in a case where he or she is unable to pay bills, he can help in that aspect, like make the hospital to waive the bills and all that. How does this happen? So who pays or who employs a social worker? Because waiving bills is not something we joke with, especially with the way we understand things in this country. Thank you.
Okay, Mr. George, over to you, please.
Yeah, if I got his question, it is I want him to understand that there is the head bill, the national head bill, made it mandatory for all federal hospitals to accept and treat patients. So every hospital has made arrangement for how they can waive certain bills, because because of the economic, because of what I'm trying to say next time is this: a patient has a right to be admitted and treated within the Constitution of the Federal Republic of Nigeria. Now, but there are patients that will now be treated and then they'll be unable to settle their bills. It is a responsibility of social workers to work with NGOs, with the family, with the church, faith-based organization, and see how they can raise money to pay. Where it becomes practically impossible, social workers are supposed to approach their management. And if it's a federal hospital or a government hospital, they may not have issues waiving the bill because the patient bill of rights, because of the patient bill of rights. So in our hospital and Federal Medical Center, we have a wonderful management. Once a memo comes from the medical social workers in respect of waiver of bills, they look at it critically and evaluate it and approve. But before we get to the point where we ask for waiver, it means we have been able to exploit all the avenue, have been able to go all over. We have been able to go round. Sometimes you also look for internal resources within the hospital. And where it's practically impossible to raise the money, you know, we are not supposed to keep or take patient in hostage. When you don't release the patient, it becomes hostage taking. That is medical kidnapping. And so we don't want to be accused of that. Federal hospitals know what to do when patients are unable to pay their bills. Social workers, part of their responsibility is to be able to assess and predict whether this patient is going to end up with discharge problem or not. Once they admit the patient, social workers go there quickly to assess the patient's ability to procure, and then they should be able to do prognosis and come to a conclusion that this particular patient is likely going to enter discharge problem. Discharge problems are problems when patients are unable to pay their bills. So when you're unable to pay your bills and you are in a federal hospital, it is the responsibility of federal government of Nigeria to see how they will treat you and discharge you, and if possible, rehabilitate you, because there are social workers in the areas of rehabilitation. So after discharge, I am supposed to follow you up and see that you are rehabilitated into an economic activities that will help you function well as human beings.
Thank you very much, Mr. George. Okay, for you are bringing up serious issues adding to the education that we are getting here. I want to believe that we are
Seriously,
becoming
yes.
further enlightened. Mr. Bichi is laughing. I don't know why you're laughing. It's okay.
Seriously, sir, because we did not know this the situation
Yes.
like the way
Yes,
things like
you
this.
see, we learn every day, and they say information is power. I heard somebody saying this certificate, we need to get them into the Association of Medical Social Workers. And you see, what people don't understand is that you don't stand in one place, according to the Igbos, to watch masquerade. You watch masquerade from different directions. Now, if the only thing you've gained from here is to know that you cannot be held medically, you cannot be a medical hosted, then you should know that, yes, you've learned something. You should also know that once a patient gets to the hospital and is getting to a point where the person cannot foot the bill, especially in federal medical centers, something can be done, and that there are medical social work. In fact, before now, most persons never knew that medical social workers are so unique, so powerful, and so useful in federal medical centers, in hospitals, and in other locations. And with this training, I'm sure you will look out for a medical social worker and make friends with them. In fact, they are some of the best set of people in this country you should be close to. Thank you very much, Mr. George.
Doc,
Yes.
please.
Thank you.
Please, Doc.
Okay. I want to say thank you to Mr. George Uke. I want to also say thank you especially to Alhaji Abubakar Bichi. We appreciate your time. It has been a very, it's a moment of salvos, of non-stop activity as well as medical social work is concerned. We are moving on to another related area right now, which has to do with talking to a physiotherapist that will tell us more about his own field as relates to what we've all studied. Somebody asked a question, is this program only for medical social workers? No, we did healthcare data analytics. We also did basic life support. We are going to have speakers in this area, and hopefully by 9 o'clock, we'll be out of this place. I want to let you know that.
Hello?
Hello, yeah.
Yes, can I respond to the issue of the certificate?
Okay,
Like
yeah, go ahead.
Okay, like the participant who holds a degree in applied psychology.
Yeah.
If he comes to my hospital for a job, I can just recommend to the medical director straight as a degree in applied psychology, which is an aspect of social work.
Okay.
Now, he also has a certificate from an organization that is known to us. Yeah, so for us, it's not be a problem admitting you into a department when you have a certificate from this organization and from this training.
Yeah.
Because I know with your applied psychology, what you just need is the basic concept and the elements of medical social work, which is what you are getting from this training. And so when you come with your applied psychology degree, and plus in addition to, and you also have this certificate from this training, I will not have problem recommending, because I know that you have a bridge training, which has helped you to bridge the gap. And so I think for those of you who are doing courses or doing training here, don't have issues. Once you have a degree that is related to any degree in social sciences, you don't have issues once you are able to present this certificate to us. We will recommend you for employment, for volunteer social work, because we should not forget there's also what we call volunteer social workers. These are people who have degrees in humanity. What they just need is just a training to bridge the gap. And so they can, for example, the person who has applied psychology who's in Lagos, if I have a case, I can call him, because I know with the training he has the basic knowledge of social work. I know he will not expose the secret, the confidence. He will not expose the information. He will maintain confidentiality. He will treat my patients as human beings. He will maintain confidentiality. He will respect my patients. So I know these are the things you get from this basic training. So I will not have a problem if I see this certificate in my own hospital.
Thank you very much. Thank you very much. Thank you very much. I appreciate that. We'll be calling on Mr. Samson Samson, I hope Samson is still available. Okay, Mr. Samson, are you here?
Yes.
Okay, Mr. Samson, thank you very much. Yes, I can hear you loud and clear. Please just use 1 minute to introduce yourself. Then you can also go ahead to tell us 1 or 2 things about what you do, how it affects what we do here, and all that. Over to you, sir.
Good evening, everyone.
Good evening.
Thanks once again for having me.
Thank you.
I'm Oladipuki Samson Abiola, a certified physiotherapist and chiropractor expert. Yes, I didn't study it out in the university. I just got certified in humanities and had masters in social sciences. But due to my love for sports, I got involved in medical sciences due to human body and anatomy. You know, I played some hard games then, rugby. So along the line, we were trained in it, and I got certified at the National Institute of Sports, and I got some other on-the-job training as I was doing my other things. And particularly, it really affects a gym instructor at the same time. Also, I'm a program coordinator for primary healthcare delivery. I deal in malaria, prophylaxis, move around different communities all across the country, giving SMC and ITN, that's the insecticidal teacher net. So I'm fully into the health sector. However, in what I do, I try as much as possible to get people to live a healthy, wealthy, and very fit life. As a gym instructor, come a physiotherapist, and the masseuse too, it's very good for us as whatever we do, matter the profession, wherever we find ourselves, first and foremost is health, because health is wealth. We need to take our exercises very, very seriously, no matter the age. Though we have the way we've broken down the exercises to different stages and ages. Or if you are not a professional athlete, like we are all regular persons here, many of us, we need to take our diets too also very seriously. You see, the kind of exercises you do in your 20s should be a bit slightly different from your 30s if you are not a professional athlete in your 40s, in your 50s. Especially when you are above 40 years, you shouldn't be doing high impact exercises any longer, especially jogging. It's not good for you. All you need to get yourself involved in is walking, brisk walking, and very slight jogging. But when you have 25, you should stop it at all. It hurts the knee. Also cycling, anything after 45-year-old, cycling is not advisable. It might eventually lead to hernia. So just take your walk. And before the exercise, that's where I come into play. You need enough warm-up exercises. You need enough pre-exercises to warm up and warm down, and enough massage after the exercise to stop the aches and pain. That's where my expertise comes in. You need your body maybe at least once in 2 weeks, once in a week. You need to get your body back in shape to stop all the sores in your body. You need the physiotherapy aspect of it. Also, once you are getting off from injuries, either through sports or through any other means, physiotherapy is good. It gets you back on track and it reduces the aches and fatigues all around the body. Most times, due to ignorance and negligence, a lot of us, we want to start exercises, we want to start, okay, I want to lose weight, I want to get fit. Then you go for the first 2 days, definitely you feel aches and pains all over your body. The next thing they do is to go and take drugs, go and take anti-painkillers. That is very, very wrong. We do not advise it. If you feel pain, since the pain is not an externally impact, maybe you hit your head on the wall, or it's not a doctor recommended painkiller in any way, all you need to do is to consult your gym instructor or you consult your physiotherapist. They will do you some massage. They will change your body wherever it is. They will massage it. If it's F-flag, they will do it, whatever it requires. Your pain will go. And you always encourage people, once you come out like that, don't stop. Because you have pain, you stop today, You want the pain to go. When you come back tomorrow, the pain will be more. So the thing, once you decide to start exercising, once you decide to start living a fit and healthy life, we tell you, do it continuously and do it consistently. And very important, the key important, before you start, if you are not used to it, maybe a doctor, friends, community advises you, okay, start exercising, start getting fit, please. The most important aspect is consult your doctor for a thorough physical exam. In our community, just some few days ago, a person have not been exercising for a while, you've been advised, okay, I want to start jogging. He was jogging, he slumped and he died. That's why, please, once you're above 30 and you've not been involved in any professional kind of sport before, you need to get yourself well and fully examined before you commence on any kind of exercises in whatever form. And after that is done, you need to consult the doctor if you are feeling some strange pains, because that's what exercises. Keeping fit is always very good. When you start noticing some changes in your body. That means wherever you are having ailments already that's been hidden in your body, it shows. Maybe like when sometimes when I stop training for a while due to my busy schedule and I come back, I feel differently. Maybe that's malaria calling. If you've not exercised in that particular form, you wouldn't feel that maybe you have an heart issue or a blood pressure issue or a knee issue. But when you start exercising, you start feeling some changes in your body. That's the next thing, is to consult your medical doctor. Then it will tell you, oh, this is wrong, what's wrong with your body. It can be a lifesaver, because if you've not done anything strenuous with your body at that particular time, it might be fatal. But once you exercise, you feel pain, you feel uncomfortable in any area of your body, then you know that something is wrong. But without the exercise, without taking time out to work out, you wouldn't know that something there lurking, an evil, a death lurking around your body without you knowing, except you go out to work out. Also, during the day, we need to take enough water. Everything we do, at least 6 to 7 glasses of water per day. Then we should take low carbohydrate and low cholesterol food. That is very important. And as much as possible, in whatever we do, we should try not to eat late at night. That's too important. By probably, depending on what you do, I mean by 6, if at all, on a very rare occasion, 7 p.m., I've had my dinner. Most times I take it by 5. So people complain of tummy ache all the time. Your tummy is big, how do I do it? The first step to use is to stop late night food eating. If you can be disciplined enough, if you are hungry in the night, most times what you need to do is to nibble on some vegetable like your cucumber, your carrot. That will stop and check the hunger pan. And you will not have trouble or embarrassment about as regards your big tummy. I will stop right there for now. If there's any questions, contributions, or observations.
Thank you, Mr. Samson Abiola. You said it all. And if we want to ask questions, I know we have so many questions to ask. We're just going to take one question because we have 2 more speakers. We'll have to split the remaining time between them, just 10 minutes each. But before then, we'll just take 2 questions here. Florence, what's your question, please? Is Florence there?
Yes, I'm there. Good evening.
Good
evening, Florence.
I sincerely want to appreciate the facilitators. I'm Florence Ikala. I'm a medical surgical nurse based in Limbe, precisely Cameroon.
Thank you.
It's a privilege for me to be part of this training.
Thank you.
Yeah, my question begins from the first speaker, then right to this last speaker. I still don't know or understand why I'll be issued a certificate after undergoing this training, and then I could not pick a job somewhere, because looking at my career already, I hold a master's degree in nursing, and if I wish to become a medical health worker, it means I have to go back and start from scratch or whatever. I don't understand. So I thought that having this certificate, I could maybe pick a job somewhere because I was really excited to take part in this training. But now hearing that, I'm just having a clue on how to become a social worker. I'm really still confused. I don't really understand it. What's the need of getting the certificate? What do I do with the certificate?
Dr. Sazi.
Thank you.
Okay.
Dr. Sazi.
Yeah.
I think we should make it very clear to our participants. Even the act that's been passed in Nigeria, there are categories of social workers that will be treated as associate fellows. For example, if you hold this certificate by this training, we can allow you to come into the practice as an associate fellow, so that you have, with that, you can now go for further training. Because the International Federation of Social Workers recognize masters in social work as a social worker. When you hold a bachelor's degree in social work, you are just a graduate social worker. Now, if you hold certificates or diploma, we treat you as an associate fellow, meaning you need to also continue having more training to go to higher level. So nobody should be feeling as if this certificate will not help you. It's actually going to help you. It's going to admit you into, for example, Nigeria Association of Social Workers as an associate fellow. That is the starting point. For example, with my master's in medical social work, I still need to do PhD to be considered as somebody who has the capacity to design programs. Because at this point, at the level of masters, if you look at the curriculum, if you look at the standard, I am just a social worker. With my first degree, I was only a graduate social worker. When I got my second degree, I became a social worker. When I got my diploma, I was treated as an associate member of the Nigeria Association of Social Work. So all of you that are holding this degree, this certificate from this training, you are going to be admitted into the profession as associate fellows. And we all know what it means by being an associate fellow. It means if you're an associate professor, you need to work hard to be a professor. So I am telling you that even with my master's, if you go by International Federation of Social Workers, I still need to do PhD to be given certain responsibility in the profession. So my sister from our dear state of Cameroon, what? Cameroon, right?
Cameroon, you're right.
Cameroon.
Yeah, you're right, sir.
My sister, if you the Association of Social Workers in Cameroon are supposed to admit you as an associate member. That means that's the starting point. Now, even with your choosing profession, you have categories now. And that was why you have to do masters to bring it to a level. And then for us with this certificate from this training, if you, for example, as I speak to you, I am a state chairman of Nigeria Association of Social Workers. Anybody who presents this certificate to me at the point of registration, I will treat the person as an associate member, meaning I will require the person to also continue getting more training. My sister, are we all on the same page?
You're right, sir. I'm clear. Very clear.
Yeah. So please, if you go to anywhere outside Africa, they will still have to, they will see you as having a background in social work. But then there are also requirements for certain work in different countries. So for us, at the level of Nigeria Association of Social Workers, your training from this organization will help you to be admitted into the profession as an associate member. I think that's the beginning point, my sister. So God bless you, man.
Yes. Thank you so much.
Thank you, Mr. George.
Yes.
I always advise people that come for our programs, if you notice the program is free, nobody has paid a dime to take this program.
Yeah.
What you need first and foremost is information.
Yes.
And with all the information you have, even without the certificate, there are places you go to and you can talk like a social worker, and they will ask you, wow, are you a trained social worker? So not to talk about when you don't have a certificate.
You are an associate member.
Yes, yes. So please, ladies and gentlemen, on the issue of certificate, just understand that LaPlage is internationally accredited. We are accredited by American Council for Training and Development. We are a UK CPD accredited training provider, CPD provider. We are ISO certified, but we don't like mentioning all those titles. Just come and get the information, come and get the knowledge. And if you need a certificate, please get your certificate. As I talk to you, as I speak to you, one of the largest international recruiters of volunteers in the world are seriously making effort to work with LaPlage, because some of our students that graduated from LaPlage volunteered with some of these international organizations, and they asked them, where were you trained? They said, with LaPlage. Please send us their email. We want to have them on board with us. So the first thing first is the training, the skill, the expertise.
Yeah.
Even with your certificate, if you don't have the skill, the expertise, then what is the use of the certificate? So, madam, with the level of education you have in the healthcare sector, this certificate is enough for to open doors for you into the world of social work.
Yes, yes.
Okay.
Okay.
Yes.
Thank you so much.
Yeah, thank you so much. Yeah. You said you have a second question for the second speaker?
No, it's okay.
Okay. Okay, thank you. Because of time, we might not need to go further to take much question. We'll call on the next speaker. I want to believe Mr. Donald should be here. Mr. Donald, are you around? Mr. Donald.
Yes, I am, sir.
Okay. Yeah, Mr. Donald is going to be talking to us about data analytics. It's not going to zero it on healthcare. It's going to make it a broad approach. However, Mr. Donald, I don't know how you're going to do that. We've done all we need to do in the class already, and we have time constraint here. So we are going to, you just have 10 minutes to tell us about data analytics and how it applies to what we've learned already. Thank you. Over to you, sir.
All right, good evening, everyone. And thank you very much, LaPlage Metaverse, for the privilege and the opportunity to address us. My name is McDonald, and I'm a professional business intelligence analyst and a data analyst. Specifically, I develop data models for businesses and also data models for clinical analysis. So when it comes to healthcare and data analytics, there is a whole lot that you can actually achieve when it comes to data. In short, what I tell people is that data is life. Data is life. I listened to the first and second speaker when they were recounting the problems of social workers. And I can tell you categorically that if the hospital or the medical facility could actually keep up with their data, if they collect accurate data of patients, not just collecting the data, but also being able to translate those data into meaningful insight, it could help them solve a whole lot of those problems. Take, for instance, the case that the second speaker. Take, for instance, the case that the second speaker brought about, that some patients cannot really pay up their bills after they have been treated. Now, if you have an accurate data of your patient, let's assume you have the data of patients for more than a year or 2 years that the hospital has been existing, you can actually predict to the nearest type of customers that visit your clinic. Right from the front desk, when you ask customers or patients questions, you already know the kind of patient this is, and you have already designed a procedure to deal with those kind of patients. Now, when it comes to improving healthcare and improving medical services, data analytics and data collection is actually one of the most accurate method in doing that, because when you have accurate data collected from your patient over time based on the reasons that brings them to the hospital, you are able to improve your services. If there are 1,000 visitors, if you have 1,000 visitors, within 6 months, 1,000 persons have visited your facility. And according to your data, you are able to predict that 80% of the visitors are coming for antenatal or postnatal or prenatal care, then you should be able to design procedures, because 80% of your visitors are pregnant women, expectant mothers. So you can actually provide more room to cater for those kind of needs as well. Then also when it comes to readmittance and discharge of patients as well, you can also use your data to improve such services. For instance, when someone is discharged from your facility and within 2 weeks, the person is readmitted into your facility, when you have cases where quite a number of persons there's a high rate of readmittance of patients into the facility, it tells a whole lot about the treatment that is given to such patients. And you can only predict that or find that out from your data. As a social worker, I believe and I feel data analytics is everybody's business, because data is life. If every day you eat a particular meal and you have consistently eaten that meal for up to 3 months, if you have the right data and you have up to 3 to 5 different meals in front of you over time, without any emotional inclination, you can say, based on the available information, based on the available data, you can choose that I will feel better with this. Now, in terms of businesses and improving profitability, data is actually a very reliable source for you to do that, because you can either judge your business either by emotions or by predictions. If you go by emotions, there is no way your emotions will not fail you over time. But guess what? Data is a complex scenario of numbers. And like the saying goes, numbers don't lie. So if you have accurately collected data, that is one of the most powerful tools you have, whether as a medical practitioner or a hospital owner or a business owner. So if you can develop a data model for any business you do, whether it's a business or whether it's in the medical field, once you can develop any data model for that business, you are on your sure way to improving services, increasing profitability of the business, and also creating room for scalability of the business, because with your data, you will know at what point you are likely going to scale up that business, or if you should remain how it is. Because of time, I would want to take questions, so I wouldn't want to go too much into so many details. Thank you.
Thank you very much, Mr. McDonald. In fact, you've summarized what data analytics is all about. And I think with what you've even said already, it is simple and very easy for anybody to understand that data is live. We're just going to take 2 questions, and please make your question.
Dr. Sazi.
Yeah, okay.
Yes, Dr. Sazi, yes.
Yes, go ahead.
I want to actually thank the last speaker. Actually, it is one area that we are seeing how we can ask our management at the Federal Medical Center, Makurdi, to bring you in.
Okay.
Because like I said, there's actually this difference between psychiatric social work and medical social work. And in psychiatric social work, data is fundamental in achieving diagnosis. And so we are hoping that one day you will come down yourself, come with your team to also help us in the area of data. Social work, part of the things for us to be relevant in this health sector, we must always have data to prove that this is the kind of work we do. Because in most cases, we do work without data. And so by the time, there's what we call role conflict. Sometimes you don't know the difference between the role of a doctor, the role of a psychologist, the role of a nurse, the role of a social worker. It's because our roles are interwoven, and so sometimes everybody is struggling to be relevant. And so, but with data, a social worker should be able to just show his data of what he does every day and the result he has been getting. Because data help us to, in psychiatry, for example, it helps us to really get the figure of patients that are relaxing medication. That's what we call relapse cases. Somebody is on psychotropical medication, he's discharged, he has been asked to go home, and before you know, the person is rushed back. Maybe because he has failed to come back to clinic. But with data, you should be able to know so number of patients that are supposed to have come for clinic, but have not been able to come. And when they don't come, what's the data? What is the statistical implication? Is that majority of them will return back to the hospital with relapse cases. And so I want to thank you very much, the last speaker, because that area we'll see how I'm going to personally ask my management to see how they can invite you and with your team, because we really need to really get the issue of data analysis correct to be able to be relevant in the system. Because doctors have their data, with their data, with their data they can bargain. Nurses too have their data of records. With that they can bargain. So medical social workers and psychiatric social workers also need data. And the earlier we begin to keep our data, the better for us, because everybody is struggling to take over our job in the health sector. I mean, if we have data, we should be able to really prove that this is the work we do and this is the result. As I speak to you, if I want to know how many patients have discharged against medical advice, I cannot have it in my office, until I have to, maybe from today, I'll start keeping the data. And so data is really important in planning, and of course, in planning how you can also take care of our social issues in the hospital. Thank you very much.
Yeah, thank you, Mr. George. I would like to use this opportunity to inform everybody that very soon we'll be having a course on data analysis. It's going to be divided into two categories, the level 1 and level 2. And I can bet you that after the level 2, you can jump around anywhere and work as a data analyst and solve problems. As a matter of fact, it's one of the highest paying jobs, and experts in that area or professionals in that area are being sought after all over the world in high demand. So you can bet us to get that training any moment from now. Just keep in touch with us. And in fact, like our Facebook page, and once it is announced, you'll be the first to know. Okay, one more question, then I will move on to the next and final speaker. Adeola Adedire.
Hello, can you hear me?
Yes, loud and clear, over.
Yeah, good evening. Good evening. Thank you for the training. Thank you for the facilitating. It's really insightful. So I quickly want to ask a question, and funny enough, it's part of what you just said now. I'm a data analyst, and I deal basically with numbers like what King McDonald had said. But to my surprise, I never knew there was anything like anything on healthcare data analytics. So I was surprised that it's one of those things that made me join the training. Now, my question is to King McDonald. I would like to know, do you have special training you do for people who are really interested in joining the health team? But like what you just said now, you just said it now that, okay, there's going to be a training for two sections of training for data analytics. But now I am referring into health, being an health care data analyst. What do you have any special training, or if one is interested, like if I am interested in diverting into health, how do I get this comprehensive training? How do I get to be on board? That's my question. Thank you.
Okay. In order for me to answer your question, specialized training, data analytics is actually a very broad field. You have business data analytics, you have clinical data analytics, and then you also have healthcare data analytics as well. Like Dr. Sazer said, there will be data analytics training for level 1, level 2, and most likely level 2 will be more related to practicals, like using data analytics to solving real-time problem, both in medical, in business, because medical field, medical or hospitality is a business. Healthcare is a business. So aside the fact that you also run clinical analysis in healthcare, there is the business aspect of healthcare management. So clinics and hospitals, if they do not harness their business data accurately, that aspect of the business will be suffering. So the same thing applies to the data they collect clinically too from their patients. So to answer your questions, I am very confident that when the training is announced, it's going to touch all areas. Trust me.
Okay. Thank you.
Thank you. The training is going to have the internship or practical component that will ensure that you have a feel and apply what you've learned in the class. Then that will make it get home to the point of making you have practical knowledge of what you've learned. Thank you. Okay. Thank you, Mr. McDonald. You've done well. Also, I want to appreciate Mr. Samson Abiola, Mr. George Uke, and Alhaji Bichi. We'll be calling on Mr. Emmanuel Avese. Avese, I can see you have two numbers. Mr. Emmanuel Avese, you're not going to use your slide today. You're just going to tell us about the importance of first aid and CPR. We have only 10 minutes to do that.
Okay. Good evening, everyone.
Good evening.
Yeah, I'll just, I think from the questions from the participants, I think I'll just talk briefly on the importance of first aid, and then how you could, as a trained first aider, also aim. Because I'm seeing more questions on how can I benefit from such trainings. First aid costs across different aspects. So many people confuse first aid as being just for the medical practitioners. No, even engineers can do first aid. A teacher can go into first aid and all, because it's basic life support, which once emergency happens, sometimes even the medical doctors are not available right there. But if once a first aider is in place, it makes everything go well. Once there's right first aid, then definitely the casualties have better chances of survival and all. As we always term first aiders, our three aims are to preserve life, to limit condition from getting worse, and then to promote recovery. So to end this session, how can a first aider end? Because most times when I train people, they will ask me, this training I'm receiving, how will I end from this training? We always tell you, first aid, you not go and ask a casualty, for me to stop this blood, you have to pay so amount before I stop this blood. No, first aid is more like a humanitarian work. But you can actually end when you subject yourself to consciously make efforts to learn more, deeper on first aid. When I became a trainer, not after attending classes, I just went through the slides, and then I took certain topics of first aid and I started practicing on my own. And how do you start that? With your immediate family or your friends. You can just take up the topic, start training them on it. Something as simple as choking. Up to now, some people feel when they are choking is you give them a swallow to take and all, which is not right. But when you start training people around you, you develop that confidence. And then if you watch around the environment, there are schools, there are organizations, there are companies around that when you go in there and then tell them about the importance of them having this knowledge, they'll be able to give you 30 minutes of their time for you to talk to them. I want you make that statement before you know it. Like my personal experience, you see them start calling you, please, can we have more of this? How much are we going to pay you for you to maybe use 2 hours, use 3 hours and talk about first aid? If I should ask people online here, some of us, if we should name all the clubs right now playing Premier League, we know all that. So it's as simple as that. Because you have made conscious effort to get that information, you can actually do the same for first aid, basic life support skills. You gain this knowledge and then you train your immediate community. From there, you develop the confidence to work or train other institutions, and then you end from that as first aider. First aid is very important. There's no one right now. The world is already disaster prone. When disasters happen, most times it's what the immediate attention needed that actually saves lives and all. So I'll advise everyone online, there's no much time, but what you do is go deeper. What you have learned already on basic life support, if you want to really end as a first aider, you have to learn more and then train people around you to gain confidence to relay that knowledge to others who will actually pay you for training them and all. So
Yes,
I'll stop here and then. Yeah.
Thank you very much, Mr. Emmanuel. Usually, Mr. Emmanuel will do 2 hours non-stop of training, both videos and practicals, but he's struggling to say everything within 10 minutes, which is not used to. But I think you have learned how to summarize things now, because we've compelled you to learn how to summarize things.
Yeah.
Mr. Emmanuel works with the Nigerian Red Cross. He's the International Red Cross of Nigerian Red Cross, and is excellent in what he does. In fact, you just become perfect at the first teaching you get from him. Thank you, ladies and gentlemen. We've come to the end of this program. Ezine, you are raising your hand. I'm sure you have something serious to talk about. What is it? Ezima. What is the question, please? Ezima, are you there? Okay.
My question is about for the basic life support. I actually work in a school and is dental therapy profession, and then we need this basic life support, not just only the certificate. We need the practical aspect of it. Want to ask Mr. Emmanuel, is there a way he can do this, just come to the school and do it for the students that need this? I will be the one to arrange everything about it. Is there something like that?
Where are you based?
Enugu.
Okay, what will happen is just talk to your trainer in your class on WhatsApp that during the Zoom session, the person that spoke about first aid, Mr. Emmanuel, that you want to get across to him, that Mr. Osaze said, you should be linked up to him. So you can get my number from your trainer in your class, then talk to me. I will just link you up with Mr. Emmanuel. That shouldn't be a problem. I'm sure Mr. Even if it's America, Mr. Emmanuel will be ready to go to handle that for you. Yeah.
All right.
Thank you.
Thank you very much.
Okay. I can see so many hands raised up now. What's happening? Okay, and you're all women. Okay. Ugochukwu Queen, Let's use the remaining few minutes to sort ourselves out. Ugochukwu Queen.
Hello, good evening.
Good evening, madam.
Good evening, Dr. Osazi.
Yes.
Thank you so much for this privilege.
Thank you, madam.
In fact, I am so enlightened and more empowered.
Thank you.
I want to compliment what Mr. Emmanuel just talked about first aid and Red Cross. For some people that are asking the question, how can I earn from being a Red Crosser or from being a first aider? I want to tell them that you can be that even without earning, but it is for the safety of yourself and that of your society at large. I have also been a volunteer for 15 years now under Nigerian Red Cross Society, and it has given me a lot of privilege and enlightenment in so many areas. So if they can be able to locate any Red Cross Society branch in each of their states, they will be able to understand more about basic life support, be trained, get basic certifications, and then continue from where they will be able to be directed. Thank you very much.
Thank you, madam. That is excellent. In fact, before I forget, I want us to also know that we have viewers and participants live on Facebook. They are with us, and they are following this proceedings or this program that is going on. Okay, before we conclude this program, I want to quickly say that we are working seriously before the end of the year to have our training coordinators in all states of the Federation, starting with Nigeria anyway. And hopefully by next year, we'll have them in other African countries. And currently we have some in Netherlands, UK, Canada, US, and yes, we have them, and Dubai too, we have. So we have people that are going to be coordinators there, so that we might start a lot of practical sessions of our training very, very soon. Now, recently, we had a partnership agreement and with Kaduna State University Center for Entrepreneurship and Studies and Research, where we'll be running programs with the institute, the Kaduna State University Entrepreneurship. So we'll be doing a lot of practical sessions, a lot of internship, and it's going to be very, very massive. What we are doing here is deliberate, and we are employing technology, employing skill, employing expertise to reach out to millions of persons. Let me just shock you. I will not mention the name of the university. I have a small friend that just got admitted into university and went to school and just came back. And we said, when are you going back? He said, not going back. I said, why? And since he went to school for the first time, the 100 level, he has not entered the classroom. They've been teaching them on phone. The lecturer will just hand the phone, talk on phone, watch video, do assignments, go to the school portal and do your assignment. So what we are trying to let you know is that you are actually doing what people will come and do in the next 5 to 10 years. You're already doing it, and getting your certificates is a big plus for you. Getting the knowledge is a bigger plus for you, and getting a practical knowledge is the next stage we are going to. At any moment from now, you'll be informed about it. Just keep in touch with us. Okay, let me just take one more question, which will be the last concluding question, then we'll close for the night. Isa Aruna. I don't think Isa Aruna is ready for us, so we have to give the opportunity to somebody else. Denny Prince.
Hello, sir.
Yes.
Evening, sir. Thank you once again for giving me the opportunity.
Thank you.
Yes, sir. So what I want to quickly ask is, if we are to get the certificate, how much does it take? How much are we expected to pay?
It's not something you cannot afford, and that will be communicated to you in your classroom. But the whole world knows that our certificates are very, very affordable. In fact, our slogan is that we want everybody to be educated. Money should not stop you from being educated. Yeah, thank you.
Thank you.
Yeah. Okay, ladies and gentlemen, those of you on Facebook, we appreciate your time. We say thank you very much for hanging on with us. Thank you. God bless you all. And I want to believe that we've gotten ourselves enlightened. We are now more powerful than the way we were before we started this program. Go to your classroom, do your test. You are not going to get your certificate without doing a test and scoring 60 and above, in as much as it's going to be very affordable, but you must do a test and pass it. And funny enough, the test is so simple. I've been seeing people's scores, which means that people are actually passing their scores without much hazards. Once you can follow our system of studying, follow your text, watch your videos, just lying down, chewing popcorn and watching TV, looking at your TV, looking at your test, you just discover that you are studying and you are making progress with your life. And that's all we want to achieve. God bless you all. See you in class and some other time. Bye-bye. Thank you. Thank you. Thank you. Thank you very much.
Thank you.